Daybue is a prescription medicine used to treat a rare genetic neurological disorder called Rett syndrome. Daybue contains trofinetide, a synthetic version of a naturally occurring molecule known as the tripeptide glycine-proline-glutamate. The exact way by which Daybue works to treat Rett syndrome is not known, but it is thought to reduce inflammation and support synaptic function in the central nervous system. Indications: Daybue is used to treat Rett syndrome in adults and children 2 years of age and older. Rett syndrome causes problems in brain function. Children with Rett syndrome experience loss of fine motor skills, impaired gross motor skills, and loss of communication skills, including eye contact. Symptoms may also include seizures, disorganized brain patterns, scoliosis, and sleep disturbances. It is not known if this medicine is safe and effective in children under 2 years of age. How to use: Daybue is usually taken twice daily, morning and evening, with or without food. Take this medicine exactly as your healthcare provider tells you to take it. If you take laxatives, stop taking them before starting treatment. Your healthcare provider may change your dose or stop treatment if needed. Your pharmacist should provide an enteral syringe or dosing cup that is needed to measure your prescribed dose. Don't use a household measuring cup. Throw away any unused oral solution after 14 days of first opening the bottle. If you vomit after taking a dose, don't take another dose to make up for the dose. Wait and take the next dose at the usual time. If you miss a dose, skip the dose and take your next dose at the usual time. Don't take 2 doses to make up the missed dose. Dosing information: patient weight 9 kg to less than 12 kg, 5000 mg twice daily, 12 kg to less than 20 kg, 6000 mg twice daily, 20 kg to less than 35 kg, 8000 mg twice daily, 35 kg to less than 50 kg, 10,000 mg twice daily, 50 kg or more, 12,000 mg twice daily. Precautions: tell a healthcare provider about all the medicines you take, including prescription or over-the-counter medicines, vitamins, and herbal supplements. Taking Daybue with certain medicines may affect the way other medicines work and can cause serious side effects. Especially tell a doctor if you take laxatives. Daybue can cause diarrhea, so you should stop taking laxatives before you start treatment. Side effects: Daybue may cause side effects, including diarrhea. Diarrhea is a common side effect, and it can sometimes be severe. Diarrhea may cause you to lose too much water from your body, dehydration. Tell your healthcare provider if you have diarrhea. Your healthcare provider may ask you to increase the amount you drink or take antidiarrheal medicine as needed. Daybue can cause weight loss. Tell your healthcare provider if you notice you are losing weight at any time during treatment. The most common side effects include diarrhea and vomiting.